السلام عليكم ورحمة الله ومرحبا بكم مجددا في محاضرة جديدة من سلسلة محاضراتنا المراجعة أسئلة اختبارات البرومترك Review of Barometric Test Question. This is lecture number 13 in Maternity and Child Health Nursing and number 52 in Ghaith Review. Today we are going to discuss 5 questions from question number 277 up to question number 281. معكم محمد عثمان يحيى. نبدأ مباشرة. Question number 277. What is the meaning of the acronym of REDA, R-E-E-D-A, which is used to assess the perineum after birth? The options are: number A, the status of age of the perineal wounds; number B, presence of discharge from the perineal wounds; number C, the presence of bruising of the perineal area; number D, excessive swelling of the perineal area. وقف الفيديو هنا واختار الخيار بالشيء الصحيح. The correct option is option number A. اللي اخترنا الخيار رقم A نشوف rational. REDA, REEDA, refers to a scale used to assess all type of postpartum perineal trauma and healing in vaginal birth. It includes 5 factors associated with the healing process: hyperemia, edema, ecchymosis, discharge, and approximation of the wound age, which are redness, edema, ecchymosis, discharge, approximation, or REEDA. So the correct option is option number A. Question number 278. A pregnant woman has visited the antenatal clinic. Her last menstrual date was on 10th August this year. Her menstrual cycle was regular at 28 days. What is the expected date of delivery? The options are: number A, 17th of May next year; number B, 21st of May next year; number C, 23rd May next year; number D, 25th May next year. وقف الفيديو هنا واختار الخيار البشي والصحيح. The correct option is option number A. اللي اخترنا الخيار رقم A نشوف rational. The expected date of delivery is calculated by adding 1 year and subtracting 3 months and adding 7 days to the first day of a last menstrual period. If the last menstrual period is after 31 of March, and keep on the same year if the last menstrual period is before 31 of March. So the correct option is option number A. Question number 279. A 30 years old woman, grade 3/2 in her 20-week pregnancy, was complaining of increased leukorrhea during past weeks. The nurse reassures the mother and explained the reason of this secretion. The options are: number A, vaginal infection; number B, expansion of the uterus; number C, stimulation of the cervix; number D, production of estrogen. وقف الفيديو هنا اختار الخيار بالشيء الصحيح. The correct option is option number D. اللي اخترنا الخيار رقم D نشوف rational. Leukorrhea is a clear or milky white, odorless vaginal discharge. This type of vaginal discharge often increases during pregnancy due to the added blood flow to the area and the increase in pregnancy hormone like estrogen. The additional blood flow and pregnancy hormone stimulate the mucous membranes in the vagina to produce more discharge. So the correct option is option number D, production of estrogen. Question number 280. Lochia red sometimes happens during postpartum to bleed heavily with full smell for the first 3 to 10 postpartum days. The nurse should expect, the options are number A, lochia pink, number B, sign of abnormal hemoglobin, number C, infection, number D, bleeding. وقف الفيديو هنا واختار الخيار بالشوف صحيح. The correct option is option number C. لو اخترنا الخيار رقم C نشوف rational. Lochia can have a distinct odor similar to menstrual blood. But if lochia has a full smell or heavy bleeding accompanied by fever or chills, that can be sign of postpartum infection. So the correct option is option number C. Question number 281. Which of the following assessment findings indicate laceration of the canal in the fourth stage of labor? The options are number A, red-brown lochia, number B, firm contracted uterus, number C, fundus is palpated at the level of the umbilicus, number D, more than one saturated perineal pad per hours. وقف الفيديو نختار الخيار بالشوف صحيح. The correct option is option number D, more than one saturated perineal pad per hours. اللي اخترنا الخيار رقم D نشوف rational. Vaginal tears during childbirth, also call it perineal laceration, occur when the baby's head is coming through the vaginal opening and it is either too large for the vagina to stretch around, or it is normal size but the vagina does not stretch easily. Perineal laceration is one of the most common causes of postpartum hemorrhage, in addition to uterine atony, retained tissue product, coagulation problem, and uterine rupture. So the correct option is option number D, more than one saturated perineal pad per hours. شكرا جزيلا، نتقابل في محاضرة جاية. Don't forget to support us by comment, like or subscribe.